The acne medicine Accutane is all over social media, not for clear skin results. CNN says Accutane users on TikTok are making the case for the, quote, Accutane nose job.
Yeah, okay, I need to know more about this. So joining us is 90s medical expert, Dr. Payal Kohli. First things first, let's talk about Accutane. I know a lot of people, my husband's used it. You said you've used it.
Yeah, in
Very
college.
strong acne medication.
Yes.
Why does it work so well?
It works amazingly because it pretty much hits everything that causes acne. So if you think about what causes acne, especially refractory acne, it comes from excess oil production. So it shrinks the oil glands on our skin. Less oil equals less clogged pores. It prevents clogged pores. Less clogged pores equals less inflammation. So it actually reduces the inflammation, and then that means less bacteria get stuck. So it reduces the bacterial load on the skin. So Accutane is a vitamin A derivative, and it's been one of these amazing medicines that's changed the course for people with cystic acne, nodular acne, even those that have scars. It can help with that.
Yeah, it gave me, I had horrible acne and it gave me like...
Your skin looks perfect.
Yeah, I know, your skin is like legit perfect.
Thank you. It gave me crystal clear skin. Wow. Like, that was back when I was at UCLA.
And you took it as a pill, right?
I took it as a pill, but I remember having to get a lot of blood work. And I remember also the pills had like a pregnant lady on it with a big X saying like, do not take this if you're pregnant. So what are some of the side effects of Accutane?
Yes, so as you alluded to, it can cause severe liver function abnormalities. It can cause problems with your cholesterol. It can cause nose bleeding, of course, dry skin, chapped lips, but it can cause severe birth defects if you accidentally get pregnant with it. So before we actually start it, sometimes we even have women sign a form that says we reviewed with them that you're not going to get pregnant on this, because usually the birth defects are so severe that you can't even carry that pregnancy to term. So it's not just a cosmetic treatment, it's very much a medication that has a lot of side effects.
Okay, we're not having any more kids, so let's talk about the nose job.
Are we having the nose job?
Yeah, I mean...
I'm interested.
Are
What is
you?
it?
Look at that little nose.
Thank you. No, I'm just curious. How does that work?
Yeah, it is interesting.
Yes, okay, so Kendall Jenner was talking about this on a podcast, and that's how it sort of started trending everywhere. But essentially, remember I told you what it does. It shrinks your oil glands, and it shrinks the oil production. And we have a ton of oil glands on our nose, and some people even more so than others. So essentially what it does, it can't change the shape of your nose because that's cartilage and bone. The only thing that can do that is surgery. But what Accutane can do is shrink the oil glands on your nose, reduce the puffiness of your nose so that it brings out the contours on your nose, particularly at the nasal tip right here. So it can give the sort of illusion or appearance of having a finer, more carved out nose. Now this is especially effective for people with rosacea. Have you ever seen those people with big, thick, bulbous noses?
Yes.
That's called rhinophyma. It actually helps to reduce that. So that's another indication for which we use this oral Accutane. But if you have thin skin, like you guys, unless you have a thick nose with lots of sebaceous oil glands, it's really not going to do much except those side effects.
I feel like she just didn't want to admit that she maybe had some cosmetic surgery done. I'm being honest.
Yeah.
I think she's just like, it was the Accutane.
When celebs do that, it just blows my mind. Like, be
know.
real. That's just going to make you connect with your audience more. I'm
Well,
like, you ever want to know what I've had done? Let's talk about it.
Same.
But I am curious, like, say somebody is interested in this and you don't necessarily have acne, but you want to take the medication. Could that have harmful effects?
Many harmful effects. So I would not advise this for a nose job, because even think about it, ladies, like, you know, a lot of people take water pills to lose weight.
Yep.
Terrible idea, right? Because all you're doing is dehydrating your organs. And then the minute you stop the water pill, what's going to happen? You may even get a rebound effect. So similarly with this, not to mention all the side effects, liver tests and the interactions, the pregnancy harm, all that. But I mean, it's just going to go back to where your setting was the minute that you stop it. So if you're thinking about Accutane for acne, game changer. If you're thinking about Accutane for rhinophyma, because you actually have rosacea and your nose has gotten swollen over time, great. But if you're thinking about it just because you want a finer, more carved nose, I really would say talk to a plastic surgeon instead, because this is not a fix-all. It's just a Band-Aid on the problem, and it has too many side effects.
All right, Dr. Kohli, I think that's great information.
It really is.
Thank you.